Hello everyone, this is our Dental Talk Without Secrets, and today we're going to be discussing this pretty complex case about direct veneers. This patient, she has some pretty difficult issues, such as at the left side, her lateral is actually a peg tooth, and on the right side, the canine, okay, the cuspid, the permanent cuspid is on the place of the absent lateral, okay? So she doesn't have the right lateral and she has the canine on the place of the lateral, and on the place of the canine she has a baby tooth, okay, a deciduous canine. So it's a pretty complex case. Actually, in my opinion, this patient should be referred to an orthodontist so that she could put everything in place, correct all her bite. I'm pretty sure that baby tooth over there is not gonna last too long. Her, its root has the normal size of a baby tooth, but actually the tooth already has some mobility, so I don't think that's going to last too long. But the patient, in this case, she was going to get married. She had a social event and she wanted something to be done until she had the chance or gathered the money or whatever, a better financial situation to go through a more deep treatment, a more let's say a more multi-centered treatment, okay? Ortho, surgery, implant, okay? So for now, our proposal to the patient was to make some changes so that her smile would look more appraisable, more nice. And so that's what we proposed to her. Okay, we needed to do some gingivectomy, a very light gingivectomy with a diode laser. And then the first thing now that we did was to remove all the old composites. And removing old composites is not an easy task. It's not too easy to do that, as many people might think. So usually we use 12 blade, okay, very carefully, not to cut your finger, not to cut patient's mouth, okay. And then we use discs, we use carbide burrs, we use multi-blade burrs, right? We use um, diamond burrs, fine diamond burrs like that one over there, and we keep changing those instruments. And the idea here is to preserve the most that we can from the patient's sound tooth structure, okay? And but still, you can see that it takes a long time to remove all the old composite. It's not, as I said, an easy task. And even when you're going to acid etch those teeth, you're going to see that there's still some composite on top of those teeth. This is these are her teeth after removing mostly all of the composite, the old composites. But here you can see, especially here at the canine, which is in the place of the lateral here, you can see that some grinding, was already done on that tooth. That wasn't me. You see, you already have some dentin exposed here, which is not too good. But we try to do the best here to preserve whatever we can from her from her health dental structures. Okay, so we're going to use the rubber dam here because as you saw here, her gingiva was bleeding in many places because of our attempt to remove the old composites, and she has a very thin gingival type, which is not very favorable to use, to not use the rubber dam. So we chose to use the rubber dam. You see that most of the teeth we didn't need to do we didn't need to tighten a knot with the dental floss, but at the peg tooth we needed to do that. So here we're going to we still have some composites, as you can see, This is the image you see here is the one we're recording through the microscope. Everything that we do in our practice, we do looking through a microscope. So what you see here is not just a camera recording what I'm doing. It's exactly what I see while I am working. Okay, so I'm trying to remove not just the old composite, still composite that was there, but some of those white stains also. Okay, we're also removing some of those white stains. So here it is. We're going to do the acid etch. After we wash it out, you're going to see that we still have some composites. And we're going to remove them again. And then we're going to acid etch again. And then we're going to dry again. And then we're going to see that there are still some old composites, and then we're going to remove them. We're going to acid etch until everything is finished. You can see at the back tooth over there, the lateral, you see a lot of composites, okay? Some people say, well, you can bond the new composite over the old composite, but I don't want to do that. I want to bond on top of enamel because that's where we have the best adhesion, okay? So you see, there are still some spots with old composites, as you can see. You see there, here. So I keep doing that until I'm confident that almost 90, at least 90% of the old composite is completely removed. Okay, preferably 100%. Then I'm using the universal adhesive from 3M, and I'm evaporating the solvent, and then I'm going to do the palatal shell using a matrix template that we made from a wax-up. Okay, we made a wax-up according to our study, and now we built a silicone matrix, and over that silicone matrix we're going to use a composite to make what we call a palatal shell, over which we're going to be building our restorations. Okay, so you see I'm doing the palatal shell on the 4 incisors, but I'm going to build the true central first, and then I'm going to do one lateral and the other lateral, and then in another appointment I'm going to do the canines. Okay, you see that I'm separating those teeth. You can see that the middle of those two teeth is not exactly at the middle of the space. One tooth at that space, at that diastema, is slightly larger than the other one. Okay, so I'm going to use here a metal matrix that is usually used to do class 2 in posterior teeth. You just place it vertically, and then I'm going to build a proximal wall to that central. Okay, I'm going to do that proximal wall closing half of the diastema, and then I'm going to do the same thing on the other tooth to close half of the other diastema. Okay, as you can see there. I'm still finishing, and measuring the space correctly, and now I'm going to do the other tooth. You can see here that I had to clean the surface of the tooth a little bit, even though I had already used my adhesive, but there's no problem. I didn't touch any enamel, just composites. So I just wash it out. I place a little bit of composites. I dry it very thoroughly. Okay, I evaporate all the solvent, all the water, everything out of the adhesive, and then I don't polymerize it, and I'll go on with my restoration. So now I'm going to see, I clean it up. You didn't see there, but I placed a little bit of adhesive. I evaporate all the solvent, and now I'm going to do the other half of the diastema closure. Okay, as you can see here, using the metal matrix, the same metal matrix that we use for posterior teeth. You just use it vertically, okay, in a vertical way, as you can see there. So once I did that, I'm going to do the distal walls, okay, the distal wall on the tooth number 8, and then the distal wall on tooth number 9. Okay, that's what I'm doing. Actually, I'm doing like a how do you say, like a frame to that tooth, and then I'm going to fill in that frame with with a layering composites. Okay, layering my composites. Okay, so now you saw that I put a little bit of flowable before placing my restorative composite, because sometimes I do that when I have a very narrow space that I have to insert a composite that is sometimes very thick, very viscous. So sometimes I place a little bit of, like I did here. Let me try to come back a little bit. I put a little bit of flowable first. You see, remove the excess. I don't polymerize it, and then I place my restorative composite on top of that. So that will make it easier for the composite to get into that very narrow space. Okay, so I'm doing the frame of those two teeth, and now I'm going to do my layering. I'm going to start with a dentin composite, an opacious composite. Okay, I'm doing it. I'm doing it on both centrals. I'm going to design to sculpt the mamelons. Okay, 3 mamelons on each tooth. I'm using a mylar stripe to separate those two teeth, and I take the opportunity not just to separate that composite from the two teeth, but also to bring that composite onto the proximal surface. So I do a movement from buccal to lingual. Okay, I do like a curved movement on one side and then on the other side. Okay, to remove the excess and to give a proper contour to that layer. Okay, so this is the dentin layer. Okay, and now, as I said, I'm going to I'm going to sculpt actually the mamelons. Okay, 3 mamelons, and then I'm going to do the subdivisions of those mamelons, as you can see there. After doing that, after polymerizing that layer, between those mamelons, I'm going to put, let me polymerize that first, okay? And now between those mamelons, I'm going to use an opalescent composite, opalescent effect composite. I'm going to remove the excess, polymerize, and then I'm going to cover the whole buccal surface with a chromatic enamel, okay? A1 chromatic enamel. And on the incisal edge, I'm going to do the same movement as I did for the mamelon. Okay, mamelon is on dentin, but here at the chromatic enamel layer, I'm going to do that same sculpture of the mamelons, and then on top of that, I'm going to use an achromatic enamel, as you see there. Okay, so after I'm finishing those two centers, I'm going to start with my lateral. Okay, this time I'm going to build the proximal surface with a mylar stripe, always bringing them from buccal to lingual surface. You can see there, and then I'm going to do the same layering technique. Dentin composite, opacious dentin composite. I'm going to sculpt the mamelons. Then I'm going to put opalescent effect enamel composite, and then after that chromatic enamel. I'm going to draw again, not draw, but sculpt again the same drawing of the same image of the mamelons on the chromatic enamel, and then finishing with the achromatic enamel. On the other side, at the canine that is going to be turned into a lateral, I'm going to do exactly the same thing. Everything is the same thing. So the 4 teeth are done exactly at the same way. You might be asking, why use two layers of enamel composite, one chromatic and the other one achromatic, just to intensify a little bit the incisal portion. Sorry. Okay, so after I finish that, I'm going to do the finishing, the polishing, And this is the final restorations for the four teeth. I didn't do all the finishing. I didn't do any polishing, okay? But that's how I'm going to stop at this moment. And then at the next appointment, I'm going to do the canines. Okay? This is the layering that I did so that you can understand, okay? Um, oops, this is in Portuguese. Sorry about that. Let me change that. Sorry. Oops. Okay, here we go. So this is the layering, okay? I started here at the palatal side, okay? At what we call the palatal shell. I use it, a nano hybrid composite from Miserium, the HRI Universal Enamel 2, okay? Which is a very strong composite. And then for the opacious dentin, I use it the same product, the Miserium composite, but the Universal Dentin 2, okay? For the opalescent effect, I use the Supreme Clear Transparent. Here in Brazil, we call Z350. Okay, for the chromatic enamel, I use the Renamel A1, and for the achromatic enamel, Renamel Light Incisal. So this is the scheme of the restoration that we did. And here, for the baby tooth, okay, I can't use the rubber dam here because I need to use a clamp, and the clamp will be hurting too much that root. The root is very small. The tooth already has some mobility. So what I did here, I use it the Ultradent Viscostat Clear with a thicker uh, a thicker retraction cord, okay? And now I'm going to remove the rest of the composite that we have at the cervical area, and I'm going to do my restoration without the rubber dam, which is not ideal. But this is a tooth that will be here in place. I don't know for how long, but it's not going to be too long, okay? Not going to be too long. But when I'm doing this, I have to keep my eyes on it so that I can see that there is no bleeding and there is no fluid coming from the gingiva. Here, there's another thing. I for me to use that silicone matrix that I had for the four incisors, I tried to use it here, but it didn't fit properly. Okay, so what I'm going to use as a matrix for my palatal shell is going to be my finger. Okay, I know that's not too scientific, but it's something that's very helpful. Okay, it doesn't give you the proper contour, but it helps a lot, as you can see there. You see the same composite that I use, the Miserium U Universal Enamel 2. Okay, you're going to see that I'm not going to have exactly the perfect shape here when I'm building the restoration. But after that is done with the burrs and with the discs, I can give the proper anatomy. Okay, here at the cervical area, I'm using a very opacious composite, not composite, I mean an opaquer. This opaquer here is from Ivoclar. Okay, it's the Empress Opaque, which is very opaque. I'm using the Empress Opaque over there. Okay, and now again I'm using the metal matrix to do my mesial contour. Then I'm going to do the same thing on the distal contour. After that I'm going to use same sequence. I'm going to use opacious dentin, and then opalescent effect composite, and then chromatic enamel and achromatic enamel. Same thing. Of course that the size of that canine is going to be a little bit smaller. I can't put that into occlusion. Okay, it's going to be a group occlusion with the premolars. That's with the bicusps. I know that's not ideal, but that's what we can, because if I put that canine into occlusion, she will lose that tooth in a very short period of time. Okay, so as I said before, I don't know how long that tooth is going to be there, but we need to keep it there until she has some plans for what's going to be done. Either she's going to do an implant there, or she's going to do ortho treatment, get the canine put into place, and do an implant at the lateral. Okay, remember that that lateral over there actually is her canine. Okay, so that's what I'm doing, and after that we're going to do the polishing and finishing and everything. Okay, so this is here. You see how I finished the canine? I did it larger, but now with the discs, as I said before, I will do the finishing and after that the polishing. Okay, I usually use the 3M discs. These are the cups from Ultradent. Okay, the Jiffy cups. This is natural. It's called natural twist from Ultradent also. Okay, natural twist from Ultradent. And now I'm using Enamelize from Cosmedent with the Flexi Buff disc, which is a felt disc, to give the final shining. Okay, to give the final shining. Okay, don't forget to get a dental floss and use it also between those restorations. We need to polish them interproximally. Okay, we need to polish them interproximally. Okay, as I'm doing there. You see, doing very properly. So this is the final restoration. Okay, this is right after finishing it. Okay, the before and after. Here, the before and after a week, when everything is, when the gingiva is well positioned, where the teeth are already hydrated, so everything has a nicer aspect. Okay, this is a view from the side. From the right side, remember we have here a canine and a baby tooth, a baby canine here. Okay, so we did something good. This is a kind of a provisional restorations, but patient was pleased, and we can keep accompanying her, into her quest towards doing another treatment. This treatment was done about 3 to 4 years ago, and she still has everything in place. We have checked on her every year, and everything is okay so far. Okay, she's happy. All the restorations are in place. Baby tooth is already in place. Is still in place. I mean, so she is very confident. She's very satisfied, and we are too. Let's see what the future brings to her. Okay. Thank you very much for watching. See you next time.